Hello, this is Marivic Llena, and my PowerPoint presentation for this week is gestational diabetes. What is gestational diabetes? Gestational diabetes is a condition characterized by an elevated level of glucose in the blood during pregnancy. According to ACOG, it is one of the most common complications of pregnancy. Gestational diabetes occurs between 20 to 30 weeks of gestation. It affects at least 18% of pregnant women. Gestational diabetes causes high blood sugar that can affect both the baby and the woman's pregnancy. In addition, gestational diabetes is a type of diabetes that is first seen in a pregnant woman who did not have diabetes before she was pregnant, and some women have more than one pregnancy affects gestational diabetes. Lastly, gestational diabetes usually show up during the middle of pregnancy, and doctors most often test for it between 24 and 28 weeks of pregnancy. Pathophysiology. Although the true pathophysiology or cause of gestational diabetes is rather unknown, it is thought that in most cases of gestational diabetes occurs as a result of impaired glucose tolerance due to pancreatic B cell dysfunction. Some risk factors include being overweight and obese, race, women who are African American, American Indian, Asian American, Hispanic or Latino, or Pacific Islander are at higher risk. Family history of diabetes, age, women who are older than 25 are at greater risk for developing gestational diabetes than younger women, or any forms of diabetes. Clinical manifestations. Although for most women, gestational diabetes doesn't have any noticeable signs or symptoms, possible symptoms may include unusual thirst, frequent urination, fatigue, nausea, frequent vaginal, bladder and skin irritation, blurred vision, extreme thirst, or sugar in the urine. Diagnostic testing. Diagnostic testing for gestational diabetes, the USPSTF recommends screening for all women between 24 and 28 weeks of gestation. There are two types of screening, including overt diabetes and gestational diabetes. Tests include the glucose challenge test and the oral glucose tolerance test. The glucose challenge test is also known as the glucose screening test. This is performed through a blood draw 1 hour after patient drinks a liquid containing glucose. If the result is 140 or higher, the patient is advised to return for another test, which is the oral glucose tolerance test. OGTT requires the patient to fast for at least 8 hours and have a blood draw done once every hour for 3 hours. An official diagnosis of GDM is made when two abnormal readings occur: overt diabetes, which is pre-existing diagnosed at initial visit, and gestational diabetes diagnosed during pregnancy. Treatment, medication, and management for gestational diabetes include referring the patient to a registered dietitian, insulin, including NPH, Novolog, Humalog, and Levemir, and lastly, metformin. If diagnosed with gestational diabetes, nutritional counseling by a registered dietitian requires individual adjustment to properly satisfy the patient's specific needs. Early detection of GDM is crucial to avoid maternal and gestational complications. Therefore, the goal in managing GDM is to normalize blood sugar levels. Patient education and follow-up. GDM usually resolves after pregnancy. However, blood sugar monitoring should be implicated to make sure there are not any other abnormalities. Other lifestyle modifications such as well-nourished diet and adequate amounts of exercise should be encouraged to prevent any future problems.